Health Check is presented by
Island Cancer Center.
The Department of Public Health and Social Services and the Non-Communicable Disease Consortium, in partnership with the U.S. Centers for Disease and Control Center, will be conducting an epi-aid survey from September 18th to October 1st. Alyssa Unkenko is a program coordinator with the Bureau of Community Health Services.
Basically, the survey will involve a environmental food scan to assess the availability, the pricing, and the promotion of healthier food options and less healthy food options in food retail venues such as supermarkets, grocery stores, convenience stores, your typical mom and pop stores, and restaurants.
The assessment would include an observation and food tally of healthy and low sodium items purchased in retail food establishments.
To give us not only baseline data to see what kinds of salt products are in restaurants and stores, but also to see if things like the Salt Reduction Initiative can help.
The assessment would also involve review of the menus, signs or displays, and interviews with the store or restaurant managers. Dr. Brenna Van Frank is with Atlanta's Center for Disease Control and is an EIS officer for the Division of Nutrition, Physical Activity, and Obesity.
The main idea of the assessment is to see what kinds of foods are available on the island. We know that there's a big non-communicable disease, almost epidemic on the island. Things like heart disease, diabetes, obesity. And one of the things that public health, and forgive me if I'm wrong, but one of the things that public health I think is concerned about is the food environment on Guam.
Information from the assessment will provide a nutrition environment baseline data in Guam. The data collected can assist Department of Public Health and Social Services and the NCD Consortium in planning future interventions, as well as provide insight into conducting additional assessments and priorities.
Because there is an epidemic on the island that was actually declared by the Pacific Islands Health Officer Association, our objectives are to have this community, our island, to live healthier. You know, there's so many chronic diseases, and we have health risk. We have healthy risk behaviors that are actually affecting the youth, and so we would like to encourage them to help themselves, their families, and the community as well to live healthier, to help us to provide healthier options.
The survey is completely anonymous, and the information establishments share is confidential. This is strictly voluntary.
The store owners and business managers are also part of this community, and it's really about the health of everyone. And so in helping us obtain this data, they can help us really decide what kinds of initiatives need to happen next to make sure that everyone is healthier.
For more information, you can contact the Division of Public Health, Bureau of Community Health Services at 735-7289. With this week's Health Check Report, I'm Jonah Goncharfris.
Health Check is presented by
Island Cancer Center.